If a young person walked up to you on the street tomorrow and asked what your government is doing to support the needs and rights of young people from key affected populations, what would you say? Here are some examples of promising programs from around the region to give you some ideas on how you can serve the needs of key affected young people who need your support. HIV testing is seen as a key entry point for many HIV prevention interventions and essential for access to care and treatment. In many countries across the region, the medical protocol on AIDS stipulates that people under 18 need consent from a parent or guardian for HIV testing, and the results must be communicated to the parent or guardian. The Medical Council of Thailand has been taking positive action to review this policy, which is a barrier for adolescents accessing vital HIV testing services. Many young people needing a test will not feel able to talk to their parents about their behaviour, and many young people involved in risky behaviour for HIV are not living in the care of their parents. Consultations have been held to review public opinion on the issue, including among teachers, parents and doctors, and discussions are ongoing with the Ministry of Public Health. In Cambodia, the government has provided a supportive environment for Family Health International to respond to the needs of young women selling sex. The Smart Girl program recognises that many young women selling sex do not identify as sex workers and uses creative, innovative ways to reach young women in entertainment establishments, providing education, contraception and HIV testing and counselling. The program successfully reaches entertainment workers by using engaging approaches that treat them respectfully and celebrate smart and positive behaviours. The Vietnamese government, supported by the BBC World Trust and Vietnam Television, ran a national mass media campaign to raise awareness of the risk of HIV infection among young people, promote prevention of HIV, and change attitudes towards people living with HIV.
Đây là quảng cáo dành cho các bạn nam tuổi từ 15 đến 21. Nếu bạn không thuộc nhóm này thì hãy chuyển kênh khác vì đây là điều tuyệt mật. Chào bạn khỏe không? Nào, ngồi gần vào tôi xem nào. Trông bạn có vẻ lo lắng. Bạn đã làm điều gì khiến mình phải lo lắng chưa? Ví dụ như quan hệ tình dục mà không sử dụng bao cao su, hoặc tiêm trích ma túy, sử dụng chung bơm kim tiêm. Tất cả những việc làm trên đều có thể khiến bạn bị nhiễm HIV đấy. Nếu vậy, bạn phải đi xét nghiệm HIV thôi. Hãy đến trung tâm tư vấn và xét nghiệm tự nguyện đi.
How can we program effectively for young key affected populations if we do not know who they are, where they are, or what they need? Governments are increasingly recognising the need to collect data from and with young key affected populations to inform policy and target programs. In Bhutan, the Department of Youth and Sport was supported by UNICEF to conduct an assessment of vulnerable and at-risk adolescents. The study has helped the government identify key affected groups and target interventions where they are most effective. Young people are showing their will, passion and energy to to engage in HIV prevention and response work at a national level and are asking governments to listen to their needs. Youth Lead is a network of young people from or working closely with young people from key affected populations. With a growing number of young people representing key affected populations in over 16 countries across the region, Youth Lead's network members are working to improve the situation at a national level and welcome governments and other stakeholders to consult with them on the needs of YKAP groups. These promising examples demonstrate that a number of governments in this region are programming for young key affected populations. From inclusion in national strategic plans to data collection, outreach, and mass media messages, governments are demonstrating their commitment. The challenge is to ensure that all governments make this commitment and that commitments are followed up with effective policy and programming. What will you do?